meditation. So once we start with the meditation, we will go to the next session. That will be with the doctor, not doctor, but the Trisha Patil. And she will introduce herself and give her background and everything. So somebody's microphone is on, so maybe let's turn it off. I believe Trisha is yours.
Sorry.
Okay, I believe we have another musician joined, so we'll ask her. Solange. So Solange, are you there? Okay, I don't hear back from her. So we will just begin then. So let's get comfortable where you are. Ease the body, chin parallel to the ground. And then take a deep breath. And then close your eyes. So take a moment to tune in with your body. So see, are you breathing through the chest or breathing through the stomach? So if you are breathing through the chest, we want to transcend it all the way down to the stomach. Now following rhythm of the breath, so see how many counts per minute are we breathing, and then any correlation we find between the heartbeat and then our breath. So start relaxing the body. So our body is still. So we take our mind to these areas. So go to the toes and then relaxing the heels, then the knees, and then the hips. Then the palms, then the wrists, elbows, and then the shoulders. Relaxing the lower back, then the middle back, back of the neck, back of the head, top of the head, whole of the face. And then slide down, open and relax the chin, slide down, open and relax the chest. Slide down all the way to the belly, and then let the breath take over. Just flow with the breath. So as you breathe in, so you pause. And then as you breathe out, you also pause. So let the mind just be with the breath. So any thoughts, let them come, let them go. Do not follow any chain of thoughts. So as we breathe in, so think of, I am positive. That's the affirmation we are using for this time. And then as you breathe out, so think, I am calm. So again, as you breathe in, think, I am positive. And then as you breathe out, so think, I am calm. So as you pause, we will take another word, strong. So as you breathe in, so think, I am positive. So when you hold your breath, think, I am strong. As you breathe out, so think, I am calm. And then again, pause with I am strong. So I am positive, I am strong, I am calm, and I am strong. So you'll use a different technique today. So you bring the palms like this, like you're holding a ball. And as you hold the ball, as we breathe in, we lift the palm up as high we can go, and we hold the breath. As we exhale, we bring the palm down, ease the body, take your time. And then we revert. So we bring the other palm, which was lower, to the upper area. And then again, next breath we take as we breathe in. So we lift the palm up. As we exhale, so gently bring it down, ease the body, and then again make the change. Right? So you breathe in and then go up again. As high you can go, as much you can continue breathing in, then pause the breath, and then as we breathe out, so you bring it down, ease the body, and then change. So let's go to the left as we go, as high we can go, and then pause it, and then as you breathe out, so go down, ease the body, hold it, again change. So as we breathe in, so lift it up as high we can go, count 5 to 15, and then as we breathe out, so bring it down, ease the body, take your time, change, and then breathe in, so lift it up as high we can go, and count 5 to 15. As we breathe out, slowly bring it down, ease the body, taking a moment, gently bring the palms resting into the lap, ease the neck for a moment, close your eyes. Let the words repeat in your mind. So though our palms are to the roof, you think the whole deep connection with the sky above and to the ground where we are sitting, even in the chair. And then with all this wonderful energy channeling all the way through the top of the head to the ground, from the ground to the top of the head. As you breathe in, so think I am positive. As you hold, think I am strong. As you breathe out, so think I am calm. And then as you come back into the center, so think I am strong. So our musician had joined. So I'm going to request him to play music when we continue the meditation. So stay in silence and just listen and enjoy the music. Dan, are you there?
Yeah, Dan is there. Yeah.
Yeah, so when Dan, you can unmute yourself when you're ready, please. Or Som, you can do it.
I'll do it. I'll do it. Done. Dan,
Thank you.
over to you, Dan. Look forward.
So other people don't lose your touch with the principle. Stay into the same rhythm. We are just working with the technicalities. You can start that.
Should I play over this music that you have going?
Yes, absolutely. Thank you, Dan. Maybe you can mute yourself. So let's go back to the affirmation again. So as you breathe in, so think, I am positive. And then as you hold the breath, think, I am strong. As you breathe out, so think, I am calm. And then again, as we pass the breath, so think, I am strong. Now, though the palms are not moving, visualize what we just did, the practice. So as we breathe in, so think, the energy moving all the way to the roof. And then as we breathe out, release it all the way to the ground. And that settles our mind and body really well. So the earth has a very grounding force, and the space in ether is very light. And our body has almost 70-80% water. And the awareness becomes the symbol of fire. So all of our 5 elements, when we combine them, suddenly our mind body joins together. And always we come to the recognition that when we become aware of our being, automatically we remember that our mind is built to hold the peace, the calmness, the bliss, the positivity, and then there is no space left for the stress. And that's why we affirm over and over till it becomes part of us. So I will recite the whole affirmation. So in the moments of turbulence, I remain strong. I am positive and I am calm. So one more time. So I am positive. I am strong. I am calm. I am strong. So feel the energy all the way. If you have any areas which needs more focus, attention, take this energy all the way to that area. And then once you feel ready, so take a deep breath and then start rubbing the palms together. Massage the fingers, ease the body. Bring the palms on top of the head, so hold it. Slowly caressing whole of the face, bring them down. Then to the shoulders, to the chest, in the back, and then go all the way to the toes. Don't release any other part of the body, all the way. So back of the legs, and it starts getting lighter. So rubbing the palms, again pass it through whole of the face. Keep repeating the affirmations. So I am positive, I am strong, I am calm, I am strong, till you experience it all the way. So when we mean what we say, it makes the miracle. And we'll do the body turning. So you tap the body above and then under and then above and then under to the chest, in the back, and then all the way to the toes. And then again rubbing the palms, massage the fingers, pass it through whole of the face, and then one more time. So tap and then tap and then tap and then tap to the chest, in the back, and then go all the way to the toes. And then rubbing the palms, pass it through just whole of the face, gently massage the temples to the jaw, in the back of the ear, to the neck, to the shoulder, and then very gently make eye contact to the body, and then open the eyes. We end with one idea which comes from the ancient Vedic tradition, that pain is everywhere, but suffering is a choice. So that's what we take. And now it's a right appropriate time. So we go to the pain consultant with the affirmation that though there is pain, we are going to make the conscious choice not to suffer. and she is going to help us how to make it happen. So thanks for joining, Trisha, with us, and it's all yours. So there is a lot of enthusiasm and a lot of questions from our participants. So you're welcome, and thanks, Dan, all the way joining, and the beautiful music. So to Trisha.
Okay, it's my pleasure to be here. I am an occupational therapist with more than 20 years of clinical experience. And I also have my advanced certificate to practice hand therapy in the state of California. I am so glad I see so many familiar faces here from every morning's meditation class. It's good to be here. Thank you for joining. I'll
So
quickly, yes.
Trisha, you also want to explain your specialty a little bit so people get more familiarity. Yeah.
Okay. Hand therapists are physical or occupational therapists who specialize in the rehabilitation and treatment of the arm. So hand, wrist, elbow, shoulder. So the entire arm and those joints. And my main background is in occupational therapy. So I'll give some general tips as well for pain management. And especially on how to manage pain while limiting medication use. So the first step, like Mr. Somnath Chatterjee said, and Sachin said, this is not a medical advice. I can just give you some guidance in the direction of therapies that can be used. I will share the screen real quick. And I do recommend that if you are in pain, please see a doctor, because a doctor can help you diagnose the problem, or the doctor can give you a diagnosis and then refer you on to a physical therapist or an occupational therapist or a hand specialist. Can you see my screen?
Yeah, we can see it well.
Okay, okay. So that's me. I have lived in St. Louis, Missouri for 16 years. We moved here a couple years ago. I love the weather of California. And are most of you from California?
No, some are from outside too.
Oh,
So
okay, okay.
Yeah.
And the best thing that for me here in Cupertino has been joining Dr. Sachin's classes. And he keeps saying that it's a privilege to give. And that's what I've learned, or that was my biggest takeaway. So it's a privilege for me to give any kind of guidance. So let's talk about pain. Pain can have purpose also. It alerts us if we have strained or injured a body part. But if it lasts for longer time, for a few weeks or months, it can lead to suffering. And the problem with pain is it can affect our mood also. So let's talk about non-invasive techniques. So ideally, it would help to see a doctor first and then see a physical therapist or an occupational therapist. So they can give you a customized exercise program, because there are no one-size-fits-all treatments, because there are so many diagnoses. I see a lot of patients with hand arthritis and carpal tunnel, but I don't even treat two patients with the diagnosis of carpal tunnel the same way. So it is good to see an expert. Now let's talk about exercise. Motion, the biggest mantra for you is motion is lotion. A lot of times when someone's body part gets injured, the tendency is to not move it. if a knee is injured or an elbow is injured, because we try to protect that body part, and that makes that joint, it can make that joint go stiffer and leading to more pain. Let's see. A good, easy uh, things available at home could be a heat pack or a cold pack. If a heating pad does not help you, you can follow the recommendations on the packet of the heat pack. Your physical therapist can recommend other versions of the treatment, like TENS unit and things like that. Posture is huge, especially during this quarantine time. If you are using the computer more than usual, and even your posture throughout the day, no matter what you are doing, whether you're cooking, cleaning the house, please be mindful of your posture. Make sure the height of your desktop monitor is adjusted so the top level of the computer, uh, so the top line of the monitor is at eye level. You can also use ergonomic keyboards to reduce strain on your wrist. For hand pain, you can also use adaptive equipment or an orthosis like jar openers. We also, as therapists, we also recommend splints or braces for hands, which are again very specialized and very customized depending on the need and the very specific diagnosis of the patient. I do not give two exact same splints to a patient with the same diagnosis, for example, carpal tunnel or arthritis of the hand. We dive deep as to what exactly the deeper cause is. Joint protection techniques. Use your joints in optimal positions. Please do not text with your thumbs. I keep reminding my daughter. And try to hold your smartphones at eye level so you do not strain your neck. Generalized relaxation can also help reduce the perception of our pain. So let's say if I'm having severe pain, if I'm relaxed, I may perceive it to be moderate. Or let's say if I'm having mild pain, if I'm very, very stressed, I can perceive it to be moderate level pain or even severe pain. So if someone is in pain, in addition to all the medicines and therapies, trying to practice deep breathing, meditation, mindfulness, or listening to soothing music, anything that you find relaxing can help. Massage. Let's talk about massage. Touch signals travel faster to the brain than pain signals. So rubbing a body part can also help. Let's say if your knee or your elbow is hurting, so just rubbing, if you rub that part, those touch signals are traveling to the brain faster, blocking the pain signals, and they can take the edge off the pain. They will not really help take the pain away completely. I can show you a couple examples of the splints and braces that we give. Okay. Here is a thumb brace. I had made it for someone who was a lot smaller than me for the base joint of the thumb, for arthritis of the base joint of the thumb. And there are store-bought braces as well. But each brace is so diagnosis specific and specific to what the patient does that it helps to see an expert who can guide you. I will share some websites. There's a brace that can help with carpal tunnel. sometimes the one-size-fits-all store-bought braces don't really help anybody. Um, the pressure in the carpal tunnel is least when your wrist is straight and not cocked up like this or flexed like this. Uh, so a lot of people, when they have carpal tunnel symptoms, they go to a store and buy one of the wrist braces, which can actually keep the wrist cocked up. So I've seen even doctors issue those braces. So it really helps to see a specialist. Here are some. Here's a brace for tennis elbow. But again, a differential diagnosis is very important because some people have radial tunnel syndrome where the radial nerve is pinched here. So these braces can make the problems worse. So it's better not to self-treat. I've seen lots of people just trying to self-treat. Even a couple sessions with a qualified hand specialist may help. I will soon talk about general things that we can do with computer use. But if you have upper extremity pain, it may help to see a hand therapist. I've been a member of the American Society of Hand Therapists for past 10 years. And so you can go to this website. Make a few phone calls to find out if they are doing video visits, if you are, worried with COVID-19, to see a hand therapist or a physical therapist on one-on-one basis. If you have some other kind of pain, like back pain, you may want to see a physical therapist. And here's the website for oh, is it backwards? Are you guys seeing it backwards?
Now we can see you.
No. The letters they're back? Okay, great. Okay. Um, my husband is here to help me with the technological issues. But with his, I see a lot of people from his profession who are computer professionals having lots of arm pain because all the nerves that go into our hand and arm come from our neck. So it is very important to have your monitor adjusted to a good level. The top line of your computer monitor should be at eye level, because if it is too low, you'll end up flexing your neck. Right now, my husband has a big monitor, so his neck goes into extension. So you don't want that either because nerves can get pinched here. Um, it helps to have a padding for the keyboard. So, your wrist can stay neutral, especially for those people who are using computers a lot during this quarantine. Laptops are not really good for neck or arm body mechanics because the problem with laptops is if you have the screen at a good level, then you have to shrug your shoulders to type. You know what I'm saying? Or if you place the laptop on your lap, then you end up flexing your neck a lot. We have also ordered a sit-to-stand desk for my husband recently because like most computer professionals or even other professionals using computers a lot, he ended up with back pain. So this sit-to-stand desk helps him stand intermittently. There is also an app, Stand Up, that kind of reminds you to take breaks. So it beeps every half hour, just as a reminder for people to change their desk height. And for pain in general, it is we advise people to take lots of rest breaks, no matter what you are doing, especially for seniors. So even if you're cooking or cleaning, after every half hour or so, try to take at least a few minutes of break and do some gentle stretches, which again can be recommended by your therapist, or you can do these are just general stretches that will not really hurt you, because when we are cooking and chopping vegetables, or if we are typing, our shoulders get rolled forwards. So we call these chicken wings. So we advise people to take breaks every half hour and just stretch like that. You guys are welcome to join me. Okay. Please be very gentle with all your exercises. 1, and hold for a couple seconds. And 2, our goal is to stretch the pectoral muscles here. 3, 4, 5, 6, 7, 8, 9, 10. Okay. If you are crunched for time, you can just take a 15-second break every every half hour and do only 3 of these. The key is to move the joints throughout the day. Another thing that we recommend is alternate arm raises. So 1, 2, 3. Please do all your exercises very slowly and very gently within pain-free range. Please do not overstretch. So our goal is to move throughout the day. And okay, now roll your shoulders back. 1, 2, 3, 4, 5, 6, 7, 8, 9, and 10. So we are doing all these things to help us work against the forward flex posture that we have while typing or cooking. And you can do these either while sitting or standing. Try not to sit for extended periods of time. So try to get up and walk, or at least stand every half hour. Okay. And okay. Now let's do some wrist exercises. I don't want to give too many wrist exercises because those, depending on your symptoms, you're better off seeing a specialist, because too much of movement of the wrist, if you have carpal tunnel syndrome, can actually make your symptoms worse. Let's do some easy hand exercises. Make a fist and open. For all of these exercises, it's okay to do only 3 repetitions. Especially the hand ones, you don't even need to do every half hour. Now bring your fingers close together and spread them apart. Okay, now make a gentle O. You can either slide down the thumb These are exercises that we recommend to patients with arthritis of the hand. So these are very gentle. A lot of use may be at a higher level to do weights and things like that, but that is not something we would recommend in a group session like this, where everyone's physical abilities are different. You know, we prescribe very individualized exercise programs. I don't treat any of my two-hand arthritis patients the same way. Really, no cookie cutter approaches. Okay. Now, hold your palms together and bring your wrist close to your body and then make it move away. Now, we do not want to overstretch, so be very gentle. The median nerve passes like so. This is your carpal tunnel. For any of these exercises, do it within pain-free and stretch-free range. If you want to go past this level, if you have any pain, please consult an expert. And for those of you who have trunk stiffness, even rotating your body gently like this also confuses the brain and decreases the perception of the pain. Again, please don't over twist. Be very gentle. It's okay if you go halfway. I am going to send Dr. Sachin a handout of these hand exercises so he can forward that to you guys. Okay, that's it. So I think, do you guys have any questions? My biggest thing is I see a lot of patients of all ages, and most of them say, I'm so busy that I don't have time to exercise. But the key is take a 1-minute break every half hour. That way, it will not lead to a bigger problem. It's okay to do only 3 repetitions of 1, 2, 3. I'm just trying to show you how quick it can be. You're still being gentle and slow. 1, 2, 3, and 1, 2, 3. That's it. These are the biggest ones. You can also do pectoral stretches on the door, or these gentle stretches throughout the day will also help. So these 3 exercises for computer use or constant cooking during quarantine will help open up the chest. The key is to do it throughout the day. You know, every half hour or every hour, very gently. It will not take you more than 15 seconds, and we owe it to our body. Okay, do you guys have any questions? Let's open. Dr. Sachin, do you mind opening it up for questions, please?
Yes. So now she is available to, you have any specific questions? I saw one question from Cliff. So Cliff, why don't you unmute and ask her yourself?
Okay.
Yes. I have a question.
Hold on.
Oh,
Janaki,
sure.
wait. So yeah, Cliff, go ahead and ask.
Hi.
Hi.
Can you hear me?
Sure, I can.
Wonderful. My question for you is, you mentioned, I saw you do a twist and you said that for hand pain. Can you talk a little bit more about that?
Oh, it's not for hand pain. It is for overall pain from sitting.
And you said something about the twisting will do something to the brain, it confuses it.
Right. Oh, that has a very, very complex explanation. It's very helpful in chronic pain. Some chronic pain patients go through a lot of physical therapy and see a lot of doctors. And chronic pain is a whole different ball game where it changes. The pain has lasted for more than 6 months to a year. So we have a map of our body in our brain that has different parts of the body represented. And some scans have shown that, let's say if my elbow is hurting, the area in the brain representing that elbow can become bigger. So that has a very complex explanation.
So when you do the twist, it kind of confuses the mapping.
Right,
So it
right.
Oh, that's fascinating. Fascinating.
Right. Yeah, but it has a very complex explanation. But these 3 exercises are easy to throw in because with our modern lifestyle, we have this forward flex posture.
Mm.
And there are, yes, go ahead.
I'm sorry, go
sir.
ahead. Please finish.
There are some wrist exercises that we recommend, which I am not even showing here because what if one of you has carpal tunnel symptoms, then I don't want to make it worse.
Mm.
Yeah, so.
I find this very interesting. Sometimes I get wrist pain from doing handstands, from standing on the hands and twisting out of them. And I find that I rest it for maybe 4 or 5 weeks and it will stop, but that's my only solution is just resting it and making it.
Gotcha.
Yeah. So maybe these exercises.
On this side? Is it on the pinky side of your wrist?
It's right there.
Okay. I would see a hand specialist. You know, the good thing about technology is there are so many medical systems. I know Stanford is doing video visits. I'm not sure about the other medical systems. A lot of physical therapists are doing video visits if you are concerned. And at times it takes just a couple sessions or even one visit to get ideal brace recommendation and exercise recommendation.
Fascinating. Thank you for your presentation today. It's wonderful.
Oh, my pleasure.
Can I ask
one pleasure to give.
Wait. So now next, Saroj, wait. Next one is Janaki. Go ahead, please.
I have a back pain in lower part, and it increase upward middle part and in spinal cord. Almost from 1 month.
Okay. So did you do something to aggravate the pain? Like lifting anything heavy, or did it come on its own?
No. Only exercise I am doing.
Okay. You may want to talk to your doctor about it and again see a physical therapist. But there are studies that show that even 20 minutes of walking, again gently, not fast to aggravate the back pain, but very gentle walking can activate some of the core muscles and they can help you. Try that, but you do need specific advice from a physical therapist, and because we spend so much time trying to go for a differential diagnosis. I cannot give you advice, but this apta.org, that website will help. If you look up a physical therapist near you, and when you call, ask them if they accept your insurance. And ideally, a lot of times doctors also recommend, your doctor may refer you to a good physical therapist. In the meantime, you can try and see if a heating pad may help you. Do you have a heating pad at home?
Yes.
Okay, good. That's great.
Thank you. So we have, who was there?
I am so sorry. Miss Janaki.
Yes.
And the key is to not sit for more than 15 minutes if you have back pain.
Okay.
Get up and walk. And I can say this from first-hand experience. I was in a bad car accident in St. Louis. and sitting makes back pain worse.
Oh,
So every 15 minutes, get up. Even if you're watching a movie or something, just get up, stand for a few minutes, for a minute, and then go ahead and sit back down.
and brace is useful for me?
Uh, at this time, actually, as therapist, with the newer model, depending, again, it is, we differentially diagnose the exact problem. We don't want patients to get very dependent on brace. It can be recommended if you are in severe pain just for a short time, because what happens is the muscles get used to relying on the brace, the back brace,
Yes.
and you want to get your core muscles strong, your abdominal muscles and your hip muscles and your back muscles stronger. The first step that your physical therapist will recommend will be gentle exercises to improve the mobility. After the mobility of your back improves, they will recommend these strengthening exercises. Because when the core muscles are strong, your abdominal muscles, your back muscles, they can support the spine better.
Yeah.
And so, because unfortunately, because of COVID-19, if you're not able to see a physical therapist firsthand, there are studies that show that even walking for 20 to 30 minutes
Yes.
activates the core muscle.
Okay. Okay.
But ideally, please try to at least talk to your doctor and get a referral to a physical therapist.
Okay. Thank you so much.
Okay, so Saroj, you go quick, please.
I have got pain in my foot bones.
Okay.
Bones which joint your toes to ankle. Those bones are hurting, and in the morning, in the house also, it's difficult for me to walk like a limp. I've got brace.
Oh no. I am so sorry, Miss Saroj. Again, the problem with foot pain and heel pain and ankle pain, it depends on going deeper into the cause. So it may help to see your doctor, because sometimes even if a nerve is pinched in the back, the nerve that goes all the way to the heel, around your foot, it can be from that. So you do need to see a doctor to help differentially diagnose.
I saw my doctor, and she
Okay.
did X-ray, and she said the bones will join near the ankle. I have got arthritis there.
Oh, I see. I see. I
And
see.
so she gave me these bracelets.
We can't see it,
sorry,
Saroj.
I cannot.
Your video is off, so we can't see it.
You can't see.
No.
That is, I have to put this and in the shoes. So I can't put whole day in the house,
Right. That is
For
correct.
a walk, I put them, and I feel better.
Okay, that's good. A physical therapist may recommend gentle exercises and other heat treatment, or, have you tried a heating pad or soaking your foot in warm water?
No.
Okay, you could try that, or ideally see a therapist so your exercise program is specifically designed based on your X-ray report. And if you are my sister, I would recommend you see a physical therapist. Not marketing for my profession.
Thank you.
Because it is very specific, the exercises. It's not just, but you could try heat. And even
leg exercises.
Right. Is your ankle swollen, madam?
No.
No. Okay, that's a good thing. Okay. Because or else you could keep it elevated. And again, motion is lotion. Doing gentle ankle exercises, just 5 to 10 repetitions throughout the day, maybe every hour. You can try and see if that helps. Don't stretch, don't overstretch, very gently.
Yeah. Thank you.
Okay, so next one is Kaushalya Ganpati. We have two Kaushalyas waiting, so I had to
Oh,
specify.
Shobna is waiting too.
Yeah, I saw you, Shobana. You will be next.
Sure.
We are to the end of our time, but we can go a little more to
Yeah,
get.
I have all the time. It's my pleasure.
Okay.
Like Dr. Sachin keeps saying, it's a privilege to give. So if it's a privilege to give any kind of advice or direction. I know I'm not giving specific advices. It's only because I want you to get the best and not get a cookie cutter advice over Zoom.
Okay.
Okay.
Kaushalya, we can't hear you.
Hello. Can you hear me?
No, the Kaushalya Ganpati.
Oh,
But Kaushalya, you go ahead till she gets her voice back.
okay. Okay. I just
But
want
be quick because we want to have all the questions answered before we finish. So be specific. Yeah.
okay. Can you speak?
Yeah, go ahead.
Okay. This two finger is hurting very much. Can you see me? Or
Yes, ma'am. I can see
okay.
you, Miss Kaushali.
Okay. This two fingers hurting so much I can't bend. When I do that, it's hurting so much. It's very painful.
Oh,
Yeah, I can't. If I do like that, it hurts.
oh no.
Yeah. First of all, this one now this started also, and this morning I was putting the bandage so that it can help.
Oh, okay.
Yeah. Yeah.
So I think for you as well, it may help to see a hand therapist using that website because there can be lots of causes of this pain. It can be either from carpal tunnel, the median nerve getting pinched, or
Yeah.
it can be arthritis. So
It's
ideally,
goes here. So,
yeah, then it can be trigger finger also. So, seeing a hand surgeon, not for surgery, but for advice, or at least seeing your primary doctor so she can x ray it and then refer you on to a therapist. Because based on the doctor's diagnosis, if you have arthritis or tendonitis, your treatment given by a therapist like myself will be totally different than if it is
yeah.
the pain is from carpal tunnel. In the meantime, you can try to use a little bit of heat. Like we were talking about how motion is lotion. In fact, if you wrap it and keep it immobilized, it can make these joints go stiff and increase the pain. And it can lead to a vicious cycle, of
Okay.
pain not moving. Because of it, joints are getting stiff, and because of the stiffness the pain is still persisting.
Yeah.
You could try to do gentle fisting
This.
and see if it helps this.
Okay.
But
Okay.
a differential diagnosis is very important, very gently making a fist and straightening. A differential diagnosis, whether it is arthritis or if it is from carpal tunnel from a doctor, is very important, because actually gripping can make carpal tunnel symptoms worse. So
Oh, I
seeing
see.
a doctor for getting a very clear diagnosis is
Okay.
very important. Even a video visit with a hand specialist. Again, to find a certified hand
Okay. All right. Yeah.
therapist.
Right. Yeah.
Yeah, but don't, instead of immobilizing it, you want to move the joints gently,
Yeah.
very gently, within
No,
painful range.
I just keep on moving. I'm trying to do my dishes or
Okay.
I'm not saying a thing. I'm just keeping it like that, like a baby. No, I come to Sachin's class every day.
Yeah, you are familiar, yes.
Thank you.
Yeah, it was good to see a familiar face.
Yeah.
Okay, Shobana.
Yeah. Thank you.
Oh, my
Thank you,
pleasure.
Kaushalya.
My
Let's go.
pleasure.
Shobana, also be very specific, please. We are to the
Sure,
end of
sure.
our time. Yeah.
Yeah, today I like your presentation,
and my back below the neck, it was hurting today. And like Sachin said, it is your choice to suffer. So I put my shoes on and went to the park. I came home and showered. And now your exercise were good. Which exercise you showed, they felt good actually.
Right. Because Shobana madam, if you are cooking or using the computer, we are like this all day. So even your walk must have helped, because when we walk, we swing our arms, right? So that helps this part too. So in a lot of our American Society of Hand Therapists seminar, we recommend a 20-minute gentle or brisk walk depending on your ability, because exercise also helps reduce overall inflammation and helps with pain. Even a good diet helps. So Dr. Sachin's wife is a dietitian. So following a healthy diet can also help with all of you, can help all of you with pain.
Yeah, I'm not new with pain. I have fibromyalgia, so
I'm so
a lot
sorry.
of time I am in pain. But like I do things, still I do things, and
that is very good.
Some days are really bad, but so I can manage. I do manage. I live alone, and I have to do my things. So
right. So
one
you.
more. Sorry,
Yes,
go ahead.
you can look into those adaptive equipment like the jar openers and, using a mini food processor to make things easy for you. And for someone like you, we do recommend every 20 minutes, take a break and alternate heavy activities and light activities. So don't try to clean the entire house in one day. Do dusting and then just sit and relax.
Okay.
And after 1 hour of rest, do a little bit of bathroom cleaning, then relax. You can even write on a calendar. You'll have to plan your activities so you are not overdoing too many activities in one day and aggravating your fibromyalgia.
You are good advice, because I don't do that. I do clean, and then I sit, watch TV. So I said, once I finish it off, I'll just sit and watch movie or something. That's what I do. Yeah.
Right. Most of us are that way. My mom was like you, like go. But then you are not alternating activity and sitting. And especially, I can empathize with you for your diagnosis. That's a tough diagnosis to deal with. So you have to plan your entire week. You can even write on a calendar what activities you are going to do. So you are not going to do way too much activity and then just sitting. For fibromyalgia also, motion is lotion. Little bit of gentle motion may help, like the walking, gentle walking.
I do yoga and all that too, but I don't know.
Excellent.
I do. And
like,
one more quick question, if you can. Night time, I pull my muscles hand, and I don't know what happens. Almost 2-3 times a week, I pull my muscles, and it takes time in the bed. So the pillow is the problem, and
it could be. It could be.
I don't know what good pillows. I'm changing pillows, different expensive pillows. Nothing helps. So I don't know what kind of pillow you need.
I can tell you from my personal experience. You can have your physical therapist recommend you a pillow, but I was recommended pillows by my physical therapist. I bought 12 expensive pillows and tried each one, nothing worked. Then my physical therapist recommended that I should fold a couple of towels to a good height. So my neck is not flexed this way or that way. I'm a side sleeper. So my neck will be in more of a neutral position. And on top of those towels, I put a pillowcase and I sleep. So quite a few physical therapists recommend that. But please be very observant. If it is increasing your pain, go back to your pillow. Because with the folding of the towel, couple towels, you want the height to be good and not, so your neck will be neutral. If it's too big, your neck will get overstretched If it is too small, your neck can get flexed, pinching the nerves here that come from
My
the neck.
bed, I
Okay,
bought
so
an
now
expensive. The bed goes little
so
up. Is it okay to put the neck up?
Shobana, our time is up. We are actually
Yes,
way
sir. Thank you.
beyond
Thank
the time. So save the questions. We will get more people like her, and she will also come again
Right,
with us, and
right,
we
right,
can
right.
ask
you.
her more
Sure,
questions. This is our first
sure, sure.
session, and always remember, in these sessions, we can't give you specific advice for your conditions.
Exactly.
This is meant for a general platform which helps you to understand the logic, when to seek help, and what will help you, and the common
Right.
generalities of this. And if you have specific questions, you have to rely on your consultants to do so. So now we also have the last thing, Dinesh Bajaj. It's one of the leaders from our Indian Community Center. So I will let him say the last thing, concluding, and that's where we end this session. So Dinesh, you go ahead.
Thank you for giving the opportunity. Really enjoyed the session. I I just had one question. You sound Indian, but you look Filipino. How did that happen?
I don't know how that happened. So what do you say? No, I
but you sound like a very good therapist. I'd like to get to know you.
Oh, my pleasure.
You.
Thank you so much.
You're welcome. You're welcome.
Dinesh's wife is a therapist, physical
She's
therapist.
I was telling her. I said, look at her. She's giving such good techniques here. But she's in another Zoom call. So
Oh, okay.
Yeah.
Oh, that's very nice. I would love to meet her.
You know, I look at this. I got my cold pack sitting right here. My hand was hurt.
Nice.
I was using it while you were giving us a session. Yeah, I was using that. So. Thank you.
All
Thank
right.
you
So thank you, Dinesh ji. So
right.
I formally
Thank you,
thank you
Dinesh.
to all our presenters today and all this fabulous group of people. We have a sizable number of people joined this call today. So the next call also we are going to hopefully explore with the same physical therapy and pain and all those. So I will send the details very quickly this time. And give us your feedback. How was it? Was it helpful to you? What else you would like to see? And then we can customize it for you. We also had some people who do Feldenkrais and somebody does mud mask and all sorts of stuff. So you will possibly get to explore a lot of interesting ideas on these type of things. And so that's where we end the session. We went quite a bit little our time, but the theme is we end the session here for now. Thanks for joining and thanks for all your enthusiasm. So
thank you.
We want to keep it very, very professional in the theme. So thank you for your participation.